Checking your stool could save your life. Look before you flush. You're going about your day doing your thing when you realize you need to use the restroom. You go in, do your business, and just as you're about to flush, something catches your eye. A slight color change, a strange texture. Something just doesn't look right. You might shrug it off as nothing. But what if it's not? What if that quick glance could be the difference between life and death? Today, we're talking about something that might make you squirm but could ultimately save your life. Checking out your stool. Yes, you heard that correctly. What you see in the toilet bowl could hold vital clues about your health. So before you flush away your worries, let's explore why looking before you flush is more important than you think. But before we get into why it's important to check out what you leave behind in the toilet bowl, let's talk about what a healthy stool should look like. The Bristol Stool chart, developed by Dr. Ken Heathon at the University of Bristol during the late 1990s. This chart breaks down stool into 7 different types based on shape and consistency. From type 1, which resembles separate hard lumps, to type 7, which is entirely liquid. Each type indicates different aspects of bowel health. Here are the 7 types of stools as described by the Bristol Stool chart. Type 1, separate hard lumps like nuts, hard to pass. This type of stool indicates constipation where the stool has spent too much time in the colon, leading to dehydration and hardening. Type 2, sausage-shaped but lumpy. Also indicative of constipation, this stool is compacted and may be difficult to pass comfortably. Type 3, like a sausage but with cracks on its surface. This stool is moving towards a healthier form but still indicates some degree of constipation and dehydration. Type 4, like a sausage or snake, smooth and soft. Considered the ideal stool. Type 4 indicates a healthy bowel movement with a balanced level of hydration and fiber. Type 5, soft blobs with clear-cut edges. Passed easily. This type of stool suggests a slightly increased transit time through the colon, possibly due to a high-fiber diet or mild inflammation. Type 6, fluffy pieces with ragged edges, mushy, often associated with diarrhea. Type 6 stools indicate rapid transit through the colon, possibly due to infection, food intolerance, or digestive issues. Type 7, watery, no solid pieces, entirely liquid. This type of stool is indicative of severe diarrhea, where the colon is unable to absorb water properly, leading to rapid and liquid bowel movements. Now, I know what you're thinking. Why should I care about my poop? Here's the deal. Changes in your bowel movements can be an indicator of anything from minor digestive issues to more serious conditions like colorectal cancer. Yes, I said cancer. Colorectal cancer is the 3rd most common form of cancer worldwide, and early detection is crucial for successful treatment. By paying attention to changes in your stool, you could catch potential warning signs early on and take action. Abnormal stool can result from a variety of factors spanning dietary choices to underlying medical conditions. Dietary shifts, such as introducing new foods or suddenly increasing fiber intake, can alter stool consistency. Dehydration can lead to hard, dry stools, while consuming excessive fatty foods may cause greasy or oily stools. Intolerances to certain foods like lactose or gluten can trigger digestive issues. Medications like antibiotics, NSAIDs, and iron supplements can affect bowel movements. Gastrointestinal infections from bacteria, viruses, or parasites can induce diarrhea or bloody stools. Chronic conditions such as inflammatory bowel diseases, IBD, like Crohn's disease or ulcerative colitis, and irritable bowel syndrome, IBS, can manifest with various symptoms, including changes in stool patterns. Furthermore, IBS, irritable bowel syndrome, and lactose intolerance can also cause different types of stool. If the stool is dark or blackish in color, it could signify upper gastrointestinal bleeding. Bright red blood in the stool could be an indication of lower GI bleeding, such as from hemorrhoids or a possible colon cancer. Thus, any change in consistency should lead to medical intervention. The red flags. So what exactly should you be looking for when you check your stool? Here are some red flags to watch out for. Blood. Immediate attention is necessary when you notice blood in your stool, whether bright red or terry black. Although it may be caused by benign conditions such as hemorrhoids, it can also indicate more serious diseases like inflammatory bowel disease or colorectal cancer. Do not wait until the last minute to seek medical advice because timely diagnosis can save lives. Changes in color. Variations in stool colors should not go unnoticed either. Although some normal changes can occur due to what you eat or medication taken, light or clay-colored stools often indicate liver or gallbladder problems. If this happens, it might be wise for one to take a step back and reevaluate their digestive health with an expert such as a doctor. Consistency. One should also look at how consistently formed their bowel movements are on average over time too. For instance, hard lumpy pieces point towards constipation, whereas looser watery sections may show diarrhea or malabsorption issues. These signs must be kept under observation and presented before professionals for further investigation. Frequency. Moreover, any alterations in frequency of passing motion need close monitoring. Sudden onset of several episodes of diarrhea within short periods calls for immediate medical attention, just as failing to defecate continuously over long durations could mean something else altogether. Left ignored, the issue at hand may contribute to avoidable complications and delay in treatment, so contact your healthcare provider if you experience changes in your bowel frequency. Why early detection matters. You might be asking yourself why you need to watch your own stool when you feel perfectly fine, but there are certain deadly health conditions like colon cancer that are asymptomatic until they reach an advanced stage where they become very hard to manage. Therefore, it is wise to keep an eye on your poop and share any concerns with a medical professional. By the time symptoms such as abdominal pain or weight loss show up, it may be too late because the illness could have progressed too far already. Early diagnosis through regular checks of stools greatly raises chances for successful treatment and cure. Finding diseases early has a significant impact on how well they can be managed. For example, with colorectal cancer, if caught in its initial stages, this greatly increases the number of available treatment options as well as forecasts for recovery. Screening tests like checking stool samples look for abnormalities such as blood, which may indicate underlying problems that need further investigation. Any person who notices persistent changes in their bowel movements which cause concern should seek advice from healthcare providers on ways of dealing with it. Early identification allows treatments to be less invasive, thus reducing complications while improving patients' general well-being. Therefore, it may seem insignificant at first look, but keeping an eye on your stool for any abnormality can be a lifesaver. This is one way of being proactive in early intervention and detection that ensures any underlying health concerns are adequately addressed before they become severe. Taking action about your health should be the priority when you realize some worrying changes with your stool. It is important not to ignore these signs, but rather act fast on them. Make an appointment with your doctor so that you can describe all your symptoms well and, if need be, undergo further examination. Failure to notice such differences sometimes could cause one to overlook serious illnesses. You can, however, detect problems early enough by seeking medical advice with eagerness, thus making treatment and management more effective. Moreover, opening up to healthcare workers regarding what ails us might offer consolation even if the root cause proves harmless. Remember that good health cannot be bought, and therefore taking necessary measures to solve anything that bothers should come naturally for self-care purposes. Whether it's scheduling a routine checkup or seeking medical advice for specific symptoms, prioritizing your health through action is a decision that can positively impact your life in the long run. So don't hesitate to take that first step towards better health by consulting with your healthcare provider today. Checking your stool is not the most glamorous thing to do, but it just might save your life. If you are attentive and watch out for changes in color, consistency, and frequency, you can catch warning signs early and take steps towards protecting your health. So next time when you visit the bathroom, before flushing, just take a look. It may change everything. Always keep in mind that your health is under your control. Do not neglect listening to what your body has to say. Start watching before flushing today.